Hello. Thank you so much for tuning into my channel today. Today's video is going to be about the shocking truths about the Panama healthcare system. Now, I've been living here in Panama for 2 years, so I have some firsthand experience, and also from talking to other expats, I want to share some of their experiences so you can learn about the good, the bad, and the ugly and make your decision before you decide to move to Panama. All right, so if you're new here, thank you so much for joining me today. My channel is all about inspiring, encouraging, and supporting women over 50 to live their best lives. And we talk about my life here in Panama. We also talk about traveling, and we also talk about health and wellness. Because if you don't take care of yourself, then how can you live your best life? Okay, so without further ado, let's get right into the shocking truths about the Panama healthcare system. These are things that you need to know before you make that decision whether or not you want to move to Panama. Okay, so we're first going to talk about accessibility and availability. There are several private hospitals here in Panama. Um, One of the most popular hospitals is Hospital Punta Pacifica, which is the only hospital in Central America that is affiliated with Johns Hopkins. Now, this is a private hospital. There's also Breesis Hospital, which is a hospital that most of the veterans use. Now, this isn't a VA hospital. This is not a veterans hospital. It is a hospital that has been approved by the federal government to treat veterans. Okay, so it's been approved by the Veterans Administration, but it's not a veterans hospital because they treat other local Panamanians as well. Another private hospital is Hospital Santa Fe, is also a private hospital that people use. Panama Clinic is also a private hospital. Patilla Hospital is also private. And one of the public hospitals is Hospital Santa Thomas, is a public hospital. There's also some public clinics um, also that are here in Panama that you'll learn a little bit about that today as well. So there's several choices here for hospital care here in Panama. So that's a pro. That is a really good thing. Okay, so let's talk about some of the expat experiences in some of these hospitals. Okay, 911. If you call the local 911, okay, then you're going to get the local paramedics. Um, they might not arrive in a timely manner, They might arrive in a timely manner. You're going to be rolling the dice. Now, when these local paramedics come from the 911, from dialing 911 on your phone, um, they will come and assess your situation to see whether or not, if it's an emergency, to see whether or not if they will approve you to transport. So just because you call 911 on your phone does not mean you're automatically going to be transported to the hospital. Okay? Um, my girlfriend's husband was not feeling well. He was having chest pains. They called 911. The local paramedics arrived and checked his vitals and did an assessment of him and decided that he was not under any emergency situation and would not authorize transport to the hospital. They would not take him to the hospital. So, because they lived close to the hospital and she was still concerned about her husband's health, they ended up walking to the hospital after the paramedics left. Okay, maybe they could have called an Uber or whatever, but I think they were just so frazzled by the whole experience because they would not take them to the hospital because they assumed that by calling 911 means automatic transport. And that's a no for the public 911. Okay? I have another situation, another expatriate situation where the husband was also in an emergency situation as far as his health. The 911 was called on the phone. The paramedics did come to the apartment. They assessed the situation. They talked about the history. They got doctors on the phone. This went on, which seemed like several minutes. And then it was later revealed that these people, the paramedics that were there, said yes, they will transport him to the hospital. However, they were not the people that were going to do the transport. So the original 911 people that were called are not the transport people. They have to assess the situation, the medical situation, and then they have to decide yes or no whether or not this is going to be transported. So they called the other people for the transport. So more minutes are going by in this emergency case, right? Okay, so here comes another set of paramedics, and they come upstairs with like a chair. Okay, now this was a patient that was not able to sit in a chair. And you would have thought that the original team would have told them that. But anyway, they came up with a chair, realized that was not going to work. So they had to go back downstairs. This is more time passing with this emergency situation to get a bed, some sort of contraption that kind of looked like a bed. Came back upstairs with that. Once the patient was loaded onto that transport, flatbed, we realized there was nothing to strap the patient down. So I said, "Do you have straps?" No, they did not. So we ended up getting a sheet from the bed to tie the patient down to the bed so that during the transport, the patient would not fall off the flatbed. So the solution to that is do not call the 911 on your phone. You're better off catching an Uber if you have an emergency or getting a friend to drive you, because you're going to waste minutes for them to even determine if it's an emergency or not. So don't do it. But there is a solution. Okay, don't worry. There are private 911 transportation ambulance services here in Panama that you can hire that are on call 24/7. They call them emergency uh, centers on wheels, okay, because they're equipped with all of the things to handle an emergency. And also, let's go back a little bit. The public 911 people that show up, there's no emergency thing. It's just a box. It's just not an open box, but the truck does not have anything in it. The transport vehicle is not equipped with anything to handle an emergency. All it is a transport vehicle. But if you hire the private service, it's called Sims, which I will put the link here in the description. I'll put the link in the description, but it's called SEMM. And I'll put the link in the description for you. But they are open 24/7, 365 days a year. They will dispatch someone to you. They also have a plan that if it's just a routine situation, they will send a doctor to your home, or you can even have a video call. So I will put the link to that private service that you can get while you're living here in Panama. Okay, so let's talk about some of the quality of care that you get here. Some of the experiences that some of the expats have had um, with some of the quality of care here in Panama. Okay, so let's talk about a situation where there was an expat who did not have medical insurance, and she went to the doctor. She had a bump and they found out that she had a hernia. So she had to have surgery. So she tried to get health care insurance to cover the surgery, but of course, because they considered it a pre existing condition, then they would not cover her surgery. So her surgery was quoted at about, I think, like $6,000 or whatever, something like that. So she schedules the surgery at the Patilla Hospital. She scheduled the surgery. She goes in for a surgery. Oh, and the day of her surgery, she had to bring someone with her as like an emergency contact. The person could not just be a name on a piece of paper. You had to come to the hospital with her for the surgery. They had to see the person. And she also had to pay up front. So they put a hold on her credit card for $6,000. That had to be done prior to the surgery. You have to pay up front, okay? So after she had the surgery, aftercare was good, everything was fine, the surgery was successful. And one of the good things is the doctor had over, I guess, estimated the price. So she was, I think she said about 600 bucks was put back on her card. They refunded her 600 bucks because he didn't need to do everything that he needed to do. So she did get some of her money back. But if you don't have an insurance here in Panama, you can pay out of pocket, but just keep in mind that you are going to have to pay up front for the before they'll do anything. There's no, sending you a medical bill later. They're going to expect the money up front if you are not insured. Okay, so let's talk about some other surgery. There was another expat who had surgery at Santa Fe Hospital. Okay, this is another private hospital here in Panama. And she said everything went well. She was out in a couple of days, and it was covered by the Santa Fe Hospital medical plan that we'll talk about a little later. I'll tell you about that. It's a local plan here that you can get here in Panama. So everything was covered. So I think she had a minimum copay, but she had no problems with that. Okay. Now there are a couple of other instances where people had surgery at Braces Hospital. There were two veterans that had back surgery at Braces Hospital. And yeah, I was just reading my notes, and both of the uh, expats used the same surgeon. They both had complications. They both, unfortunately, had infections. They said the aftercare wasn't like it should have been. And unfortunately, one expat, a female, passed away, did not make it through the complications in the second surgery. The other expat, who was a male, he ended up, he stayed in the hospital longer than he had to, but he ended up recovering from the infection. Um, there was another expat who also went to the Veterans Hospital for care, and said that she was just treated so, she was mistreated. She didn't feel that she got the proper care. So there's been some complaints recently about some of the care that they're receiving at Brees's Hospital regarding the veterans. And a lot of the veterans are switching over from Brees's Hospital to the Hospital Santa Fe, which is also a private hospital, but they are also authorized to treat veterans. So the majority of the veterans are switching their services from Brees's Hospital to the Santa Fe Hospital. So if you are a veteran, make sure you keep that in mind. Talk to other veterans and find out their experiences. I personally am a veteran myself. I went to Brees's a couple of times. One time I saw an op- optician, no, optimist, no, optometrist. uh, for an eye problem that I had. She gave me some drops. Everything was fine. Okay. The next time I wanted to go see an orthopedic doctor. I was having problems with my knee. I had to go see a general doctor at first. Uh, then he did x rays. I kept calling back to get the results of my x rays and was never, for whatever reason, was never able to get the results of my x rays. So I ended up using my federal insurance to go get that covered. That's one thing for you to check on. I'm retired federal worker, so I still have Blue Cross Blue Shield Federal. I kept that insurance, uh, and they also have an international plan. So if you do have a local insurance in the States, check with your insurance company to see if they also have international coverage. Okay. So I ended up contacting a doctor through the international coverage program here in Panama, saw an orthopedic surgeon, got treated for my knee, got x-rays done on both knees, everything was fine, ended up being treated, a preventative type treatment method, all paid directly by Blue Cross Blue Shield. They authorize direct payment. They have a 24/7 number that you call. Just tell them the appointment. They send the information directly to the doctor. So keep that in mind. If you have private insurance already in the States, check for the international plan. Okay, so that's talking about some of the care that you can get here in Panama. You can get like a routine physical that can run anywhere from 60 to maybe $100, could be a little less. Uh, you can also get X-rays around those prices. So there's lots of things that you can do. You can pay out of pocket. That's not going to cost you so much. But if you need, some kind of major surgery or something like that, then the prices can get up there. So you need to be prepared for that. Um, they also have in October of every year, they have breast cancer awareness month. So a lot of the hospitals, I did this last year at Panama Clinic, they offer um, mammograms and also ultrasounds at a very discounted price. I think I paid barely $100 for both. And the good thing was within 24 hours, maybe a couple of hours, they email you your images. So you have access to your images right away. Very modern facility, very top notch. So that's one of the good things, about the healthcare system is that it's very modernized. Okay, so some of the other things you can do, some of the health insurance that you can get. There's private and public health insurance. You're going to have to do some research if you're trying to get health insurance here in Panama. There might be some international expat programs that you can come across. But let me tell you about a couple of programs that I found out about some of the expats that have here, and I will put the links to those health care programs here in Panama. One is called Mini Med. Now, this Mini Med, there's several locations, several clinics that are located throughout Panama. Um, and these are individual or family memberships. And there's like different coverages that you can get. Some of the benefits that you can get with MiniMed are general medicine consultations. You can get lab work done, a complete blood count. You can get x-rays. You get a 10% discount on medications, a 20 cent per discount on the pharmacies. And it's like basic procedures included therapy, injectables, blood pressure, things like that. And you also can get a consultation with a specialist. I think there's one a year. And they have different packages, different pricing. And the individual membership for Mini Med is $13.50 a month. And for a family plan with two beneficiaries, it's $15.50 a month. And for a larger family plan is $17.50 a month. So that's a low cost way to get some health care, some basic health care here in Panama. And I'm going to put the link to Mini Med so you'll have that information as well. Um, One thing about Mini Med, they also have a general physician consultation uh, with your membership, and they can come to your house as well. And there's another thing, there's no age restriction for the Mini Med membership, the clinics. Um, they do, for these memberships, they don't include hospital coverage, and it does not cover emergencies or hospitalizations. Okay, so it's just general, basic primary care for medicine. So keep in mind if you do get a family plan or something with many clinic, then you're going to need a separate plan that covers hospitalizations or emergencies. Okay. Another plan you can get here locally in Panama is with the Hospital Santa Fe. The Hospital Santa Fe here has a senior citizens plan, and this is a health care plan for individuals over 60 years of age. And the rates start at like $143 a month, and they increase like every 9 years. So there's also family plans on this as well. So I'll put the link to that, and you can reach out to the representative if that's something that you're interested in, and you can find out what is covered in those plans as well. Some of the things that's covered in the Hospital Santa Fe, you're going to pay $5 for general medicine. A specialist is going to be $15, $20 for a psychiatrist consult. Electrocardiogram might be $15, 20% off on x-rays, and emergency is going to be $50. So there's several things. These are just examples of some of the things that are covered in that Hospital Santa Fe. And that's something that you can click on and find more information about. Um, so some of the things you might keep in mind, there's pros and cons, of course, of any country's healthcare plan, especially if you're not in the US and you're navigating your way through the system. The language could also be a barrier. So if you're in an emergency situation and you cannot speak the language, you need to have some sort of emergency contact, whether it's a translator or a friend that also is bilingual that you can reach out to. Have maybe an emergency card that has your information on it, or if you cannot get to it, where they can actually reach out to that emergency person. Most of the hospitals will have a patient advocate that does speak English, but if that person is tied up and the nurses are not bilingual and do not speak English very well, then there might be some issues regarding the quality of care, regarding of what they need to be doing. So you're going to have to exercise some patience, and like I said, work on getting someone in your corner, somebody on your emergency team in case of emergency that you can contact. There is, which I don't recommend, there's somebody that's selling their services for I think like $100. They're going to be everybody's emergency contact. Some expat services. I'm going to be your emergency contact. Give me your number, give me $100, and if you get into trouble, I'm going to translate for you. What if there's 5 emergencies at one time? So you're going to pay somebody $100 and you're going to try to reach them when they're not available? Don't waste your money. Okay. Hire a translator if you have to have somebody on call, whatever, or pay by the job. Have a couple of contacts. Have a local friend who also is bilingual. So set yourself up to have several people that you can go to if you need to. But don't pay somebody $100 or whatever to be your emergency contact, and they are not available when you need them. Doesn't make sense to do that. Okay, so I hope some of this information has helped you. Of course, there's lots of more information about the healthcare system. These are just some of the things that I've learned just by living here. You're going to have to do your own research, get referrals for doctors. Okay, just don't go to a doctor without a referral. Make sure you have several referrals. You check credentials, you looked at reviews. You've done everything you can do to make sure this is the right choice for you. Okay? And also trust your instincts and go with your gut. Get your emergency contact information on hand, share it with people around you, share it with your friends in the States. So if an emergency happens, you're not running around like a chicken with your head cut off. Everybody knows what the plan is, who to contact, and you can have the right assistance with you from day one, so there will not be to try to maybe not eliminate, but maybe make the situation a whole lot better if you have an emergency. All right, so there you have it, the shocking truths about the Panama healthcare system. Hope this was helpful for you. If you find this helpful, make sure you share it with someone that can use it, and make sure you like and subscribe, and please comment and let me know if there's something that we should also share with the community here. Thank you so much for watching, and I'll talk to you soon on my next video. Have an amazing day.